Diabetes mellitus is not mere problem with raised glucose levels, but it leads to several complications which are very disabling to the patients. They affect the quality of life of the patient, cause lot of morbidity and mortality. Hence, this is a disease which needs to be controlled. In addition to blood sugars, of course, we have to take care of the possible complications that occur, address the problems early in order to prevent the complications from advancing to a point of no return. One of the important complications of diabetes mellitus is a foot ulcer. Foot ulcer is very troublesome because it not only leads to infection, several types of infections, but also can cause septicemia, which is life-threatening, and in addition, patient may lose his limb, and the important cause for loss of limb among the population is diabetes, which ranks as number 1. This complication is because of two reasons. One is neuropathy, where nerves become weak in diabetics because of gradual cut-off of blood supply to the nerves. Second is vascular. The arteries which supply the limb also get gradually clogged because of deposition of fat in the blood vessels, which we call as atherogenious inflammation of the arteries. So this itself leads to clogging of the arteries. Then once the blood supply is cut off, patient develops ulceration, and it may end up in gangrene and ultimately loss of limb. Patient may also develop a severe complication, which I said earlier, a septicemia, which can be life-threatening. So patient, in addition to taking care of his blood sugar levels, should regularly check his feet thoroughly and also keep cleaning his interdigital spaces regularly. Foot care in the form of wearing proper shoes in order to prevent injury, because a patient of neuropathy has no sensation in the limbs. So he may inadvertently injure himself, may not be aware of that till an ulcer is formed, which is actually too late. Healing of the ulcer is actually a Herculean task. That's why prevention is the best. Addressing the neuropathy early is the best way to prevent ulceration and attendant complications of ulcer.